Many people have asked questions through YouTube. When will pain or numbness be relieved after surgery?
The pain or numbness after surgery varies greatly by patient. The most important factor is the patient's condition before the surgery. While we hope symptoms improve 100%, not all do, and around 20–30% may remain. Of course, many people do experience complete recovery depending on their pre-surgery condition. Nerve recovery usually takes 3 to 4 weeks a month, or up to 6 months to monitor progress. After that, it can be monitored for up to 2 years, but typically we aim for improvement by around 6 months. So the extent of nerve recovery depends on how much the nerve is stimulated after surgery and how well the back is managed. If appropriate exercise, medication, and nutrition are provided after surgery, recovery is generally faster.
Can we drink alcohol or smoke after surgery?
Absolutely not. It is negative on recovery. Smoking, in particular, affects small blood vessels, reducing blood flow and slowing recovery, and can continue to cause nerve damage. It is recommended to avoid smoking and drinking after surgery.
How long should we wear a brace after surgery?
Many people ask about wearing a brace after surgery, and this can vary depending on the type of surgery. Since the muscles and ligaments in the lower back take about 4 to 6 weeks to heal, it is recommended to wear a brace for 4 to 6 weeks to assist with the recovery. If you have had fusion surgery, it is recommended that you wear the brace for a longer period.
When can we start driving after surgery?
For minor procedures, like those done under local anesthesia that lasts less than an hour, it isn't much of a problem. For typical surgery, it is better to take 3 to 4 weeks of rest and avoid long-distance driving.
How long should we stay in the hospital before we can drive?
Typically, it is recommended to stay in the hospital for about a week to allow the muscles and ligaments in the lower back to recover. After that, driving should not be an issue, but it is good to rest for about 10 minutes after driving an hour.
What are the chances of relapse after back surgery?
Relapse can have various causes, but for patients with herniated discs, the highest relapse rate is within a month after surgery. At our hospital, the relapse rate is usually reported to be about 3 to 4%. However, if the disc condition is poor, or if there are severe degenerative changes in the spine, the relapse rate increases. Surgery is not the end. Within the first month after surgery, it is important to focus on managing the back and be cautious.
How long should we take medication after reverse prescription?
The prescribed medications come in various types. Among them, antibiotics and antibacterial medications should be taken consistently according to the prescribed duration. Anti-inflammatory painkillers and nerve stabilizers are usually prescribed for about a month. It is important to take them consistently for a month. After finishing the medication, it is best to visit again for a checkup and possibly a new prescription, depending on your condition.
What should we do if we lose our medication?
If you lose your medication, even if your follow-up appointment is a month away, it is better to come in earlier to check your condition and receive a new prescription.
If we live in a rural area, can we get a prescription from a nearby hospital?
No, it is not allowed.
Are there any other questions that patients frequently ask?
Many people ask about exercise, especially younger individuals. As I mentioned in a previous video, walking, swimming, cycling, and Pilates are very beneficial. After about a month of recovery, gradually exercising to strengthen the core muscles of the back is very helpful for managing the back. In addition, I often get questions from young people about personal training, and I recommend avoiding exercises like lifting heavy dumbbells or barbells overhead or pulling from behind. Also, exercises like squats and deadlifts should be avoided right after surgery as they put significant strain on the back joints.